Hey guys, welcome to another Lifestyle of Eden podcast. I'm your host, Nick Tognetti, and today I have a very special guest, Dr. Vik Rajan, MD. Y'all may have heard that name, and it's because I'm constantly talking about him on my social media, and I also have other podcasts with him as well. Dr. Vik Rajan is the consultant for Lifestyle of Eden. He consults with me for my toughest cases. We're continually going back and forth on some wild cases that are going on and some different things. He is an MD and board certified in integrative medicine, internal medicine, pediatrics, and nephrology, which means he's a kidney specialist, which couldn't be more relevant today, given that 1 in 7 US adults are suffering from CKD, chronic kidney disease. So, without further ado, Dr. Rajan, thank you so much for joining me today for this podcast.
Thank you for having me.
So today we're going to talk about a pretty awesome topic, and it's all things thyroid. Specifically, though, T4 to T3 conversion. And the reason that this topic came up between Dr. Vik and myself was the other day we were discussing this because in my practice, I always see people with a great T4, but a tanked T3, and they're being over medicated or they're medicated with the wrong medication. And number one, you're not fixing the root. But the thing is that if you have a good T4 but a low T3, this is not a thyroid problem. This is a conversion problem. The reason being is because your thyroid, 80% of what your thyroid makes generally is T4. Only 20% of your T3 comes from the thyroid. The rest of it actually is converted from T4 to T3. So if you have a good T4 but a low T3, what this shows is at the cellular level, you have a conversion problem. And many of the people that come to me, they're being prescribed levothyroxine, which is a T4. So we're adding T4 to the T4 that's already good, and it's still not converting or helping the T3. And Dr. Vik, how often do you see this in the medical field?
Hypothyroidism is a very common thing. We see that all the time. Now, in terms of conventional management, yes, they just give plain T4, levothyroxine. Now, having said that, uh, T3 is the active form, all right, and but your body has to convert. Some people do not convert as efficiently. Some of that can be genetic issues. There could be, or it could be any of those things I talk about in my algorithm of six that's inhibiting you from doing that. And so there are people who are on levothyroxine and they're not getting the full clinical effects of it. And that's where it comes down to really, if they would be actually better served being put on a T4 T3 combination with basically desiccated thyroid gland, like armor thyroid, for example.
P or NP
NP,
thyroid?
yeah,
Yeah.
NP thyroid, and one of those products because they have T4, T3 combined.
What
And
about Cytomel? What about Cytomel that's just T3?
It's interesting. I was reading about this, and there's a doctor who does nutritional medicine. His name is Dr. Alan Gady, and when I was studying integrative medicine, he wrote one of the major textbooks for nutritional medicine and all things like functional medicine. He's a physician too, and so I sometimes refer to his textbook when I'm looking at stuff. I'm like, okay, what is it really? Because we've been doing this for decades, and one of the interesting things he says that okay, even so, some like endocrinologists, they'll do like a T4, T3, like individual combinations and titrate it. He said that doesn't necessarily work as well because there are certain additional components in desiccated thyroid compared to just T4 and T3 by themselves that they seem to have a clinical effect in it.
So are you not much of a fan of just Cytomel if they have a T3 issue?
If it's just, I'll tell you, most of the cases I've seen though, in terms of hypothyroid, it's usually they're having both. But what they may be having is they're not converting the T4 as well. So then you're better off putting the combination. I haven't personally seen one that's just exclusively like T3, and then their T4 is totally normal, and the TSH is normal, and everything is normal.
Yeah.
I mean, it could be out there, but that more commonly they're hypothyroid, T4 is off, T3 is off, but you're giving them T4 and they're still not better.
So there's two things I want to say with that's very interesting. The other day, when you and I were on the phone about this, and I said you have to ask the question because I think functionally, right? I've never been trained in conventional, so I automatically only think functional, meaning
Yeah.
what's the root or whatever. And when I had said, hey, you know what? My question is not what is the best prescription, which is obviously the conventional method is, okay, what do we need to give them prescription wise? My thing is, why are they having a conversion issue, right? And I remember on the phone you had been like, that's actually an interesting thought process. Not what do they need prescription wise, but what is the issue with why they're not converting T4 to T3 well? Cellularly, what's hindering this, right? And there's a couple different things that I've come across. Number one, probably the biggest thing I see is simply systemic inflammation from the gut microbiome, which will make them deaf at the receptor sites cellularly, right?
Yeah.
Which will cause insulin resistance. It's not just insulin, though, it's hormone deafness. You're having an issue with all hormones, and thyroid just happens to be one of them. But it's one of the major reasons why I see pre-diabetics. They're not pre-diabetic because of a bad diet. They're pre-diabetic because they have a gut infection. It's causing systemic inflammation, all these things. That's one thing that I really see. But the other thing that I really have been coming across a lot too, and I learned this from a thyroid specialist named Dr. David Brownstein, is he talks about heavy metals, specifically mercury, and mercury binds to the enzyme that is responsible for the conversion to T4 to T3. And mercury is such a problem today, obviously, with fish, or even what he says, 80% of the cases he sees is actually cavities. That's the filler that
Mercury
they use
fillings.
is mercury.
Yep, yeah. A lot of people have had that, although, and they still use it because it's cheaper. But I remember when the few times I had cavities, my parents never did the mercury one for me. They did the composite, so you don't have that problem. My wife, though, back when she was younger, yeah, they did mercury, and so she had to get those things removed by a dentist who specialized in taking
Yeah.
that out and then replacing it with composite instead of mercury. And you have to do that carefully so you don't get the fumes and all that. So yeah, if you have something with mercury, and those things don't stay good forever, because eventually those things start to crack after a few decades. And when
Right.
it's cracking, that's when you start getting, now you're it's not before it's all contained, but when it's cracked, now it's getting open to being absorbed in your system slowly but surely. And so to that extent, yeah, it could be interfering if you're having issue with you've had mercury fillings, especially if you've been having them for a long time. Among other, in my algorithm of six, I talk about the last one, environment toxicities. And
Absolutely.
environmental toxicity, certainly water, air. But yes, if you're having mercury fillings that have been there for a few decades, then they want to get them taken out.
Well,
And
the thing about the mercury too is obviously we have mercury laden fish, right? Like tuna and swordfish and these different things. But one of
if
the
you're
things
doing
that's,
high level mercury, yes.
and what's really interesting that Dr. Brownstein talks about is obviously, so for thyroid, the number one reason for a hypothyroid has actually been credited to mineral deficiency, or whether it's iodine or selenium. And what's fascinating that I didn't even realize is selenium is one of the number one chelators or binders to mercury in the human body. And so a lot of people have high mercury, and the selenium and iodine are critical for thyroid. And what's happening is the selenium in our body is being used to bind to the mercury. And so therefore you become selenium deficient, and now you don't have enough selenium to be used for the thyroid. And
Yeah.
so you're having selenium or these minerals in your body being used to pull out toxins from the body rather than being used for the endocrine system. And so that's another reason why we have these issues. I thought that was fascinating that our selenium is being stolen by high mercury or high metal levels within the body.
Yeah, there's a very complex interconnection with all the minerals that we have and then the functioning in ways that we don't, certainly not conventionally, that we don't even fully realize. And I think even in function, there's so many different interconnections that, again, the importance of one, optimizing your diet, two, making sure you're taking a multivitamin that has all of those components in it, because your average one a day or Centrum is not going to have those components at all, let alone in a sufficient quantity. And then, of course, making sure you minimize your environmental toxicity. We're all exposed to every various toxins in the environment. Your body does have the ability to handle it, and if it's at a low amount. But if it becomes more than what your body is able to handle, then the
Right.
will result. So yes, if you have fillings and they've been old, get them out. As far as fish, depends on what type of fish. If you're taking salmon or tilapia, that doesn't really have much mercury.
Right.
You're fine
Right.
with that. If you're taking swordfish Shark, yeah, that's really high in mercury.
Oh,
For
it's
certain
ahi tuna. Ahi tuna is
tuna,
one of the five mercury laden ones. Yeah.
yeah, that's on the higher end. It's one of the higher end ones because they're higher up the food chain in terms of eating other fish.
So one of the things that I just had to see it this week, I can't even imagine how many blood works you see a week. How many I see a week is probably a dozen. But the thing is, as I see these blood works, there's a lot of them that their TSH will be fine, their T4 will be fine, but the T3 is tanked. And so I go, okay, let me evaluate further. And sure enough, as I go down the blood work, there's two markers that will be high, and I'll go, okay, this is why. Number one, reverse T3,
Mhm.
and number two, TPOAB or thyroid peroxidase antibodies. And so when the reverse T3 is high, what I have found in my practice is every time the reverse T3 is high, the reverse T3 is obviously a stress and inflammation marker, regardless of where that stress and inflammation is coming from is a whole nother topic in and of itself. But what it's actually doing is instead of free T4 converting to free T4 is now converting into reverse T3 because the reverse T3 is stealing it in order to compensate for the body being in a sympathetic state. And it's trying to pump the brakes to say, hey, Nick, or hey, Dr. Rajan, my body's in a or is in a sympathetic state, and I have to do this to force it back into a parasympathetic state. And so I see stress and inflammation with the reverse T3 actually causing the conversion issue so many times. Do you see that a lot in your practice?
That's typically when I've ordered stuff, it's like I said, TSH, T4, pre-T4, and T3. And so I haven't always ordered the reverse T3 like you're saying, but at the same time, to the extent that you're having problems with that, look, inflammation will throw off a lot of your markers. Like for example, ferritin, for example, that's something that's supposed to be related to iron stores. But when you have a lot of inflammation, that thing goes up a lot. That doesn't
Right.
mean that all of a sudden you're overloaded with iron. In fact, I've seen it where you could have a very high ferritin, but you actually are iron deficient. And in
Yeah.
which where you measure your iron saturation, and that's actually very low. And so, so what's the meaning of why is the ferritin high? That's an inflammatory marker in that case. And so, but even though your ferritin is high, you are not using it efficiently. So I think in the same way, I think it's probably the same type of scenario. If you've got high enough inflammation going on, then yeah, you're not converting efficiently. You're not getting your T3 that you need out the way it should be. And that goes to the TPO antibody. That's again, if you got enough inflammation, you're going to start getting autoimmune phenomenon. And so
Right.
that antibody, that's one of those antibodies that we measure. So, oh, you're starting to get like Hashimoto's and things like that.
So then that brings us Hashimoto's to whether it's Hashi's or any other autoimmune disease, that is every single autoimmune disease is related to the gut microbiome. So
Yep.
now we're having a gut microbiome issue that's hindering your T3 from taking place, which goes to the inflammation, the cellular resistance, all those different things.
Yeah, gut microbiome, or I put it even more broadly, the algorithm of six, of which problems with nutrition, which goes to the gut and nutrition, pretty much interlinked, exercise issues, sleep problems, stress management. That's a huge thing. You could have, I've seen people with very good diets, but yet their stress was overwhelming, and they end up getting inflamed. And then isolation, environmental toxicity. So all of those things have to be addressed and optimized. And of course, the gut's a very important part. I think of those, I'd say gut is like 50% in terms of the weighting of those six issues, which, like I said, as a nutritionist, you work with them. And I studied nutritional medicine when I was studying integrative medicine. That's one of the things I specialize in. And yes, that's a big part. But all those things have to be optimized. Talking about mercury, yeah, make sure you're not having any toxic exposures. Stress levels, what's going on in your life? How is life going for you? What can you do to de-stress it? Or at least learn to handle the stress you're dealing with better. So all of those things have to be addressed because if not, then you're going to have inflammation and it's going to come out in any number of ways. I just saw a guy in the ER yesterday. This guy had hair was interesting. I haven't seen a case of this, so I have to actually read about it. He had mesenteric paniculitis. Came in for just generalized abdominal pain, nausea, eating less, and and we did a workup, the CAT scan, and showed the signs of mesenteric panniculitis. And what is it? It's basically inflammation in fat lining that is in your belly. It's all inflamed. And another interesting thing, talk about kidneys, his kidney numbers were off, way off. And I was like, is this the first time? No, it's been going off. I looked at his old lab and it's been progressively worsening. And granted, he has a history of high blood pressure. But I'm like, what's your blood pressure meds? I take blood pressure meds 120 over 80, 130 over 80. That's it. Well, then that's not that bad. It shouldn't just, because it all deteriorated for him in a year. It was like, in fact, over 1 to 2 years. It was started like 0.9 a couple of years back. Then at the beginning of the year, he was like 1.5 creatinine, and then by the time I saw him yesterday, he was like 2.8, which is like a kidney function level of like less than 30%. And he was a little dehydrated, but even after I hydrated him, it was still like 2.5, which was not that much better. And I was like, you know what? You've got some sort of autoimmune
Is that
kidney going
lupus?
on. No, not necessarily lupus. It could be any number of things. We have a whole host of kidney issues. He didn't have any like protein in the urine necessarily, or even red blood cells in the urine, but he had this, like I said, panniculitis, which is an autoimmune component, and then also he has this worsening kidney function out of proportion to what it should be. Like and it was like in the ER. I started talking to him about functional nutrition. And look, I can give you. And now, in terms of the conventional treatment, yeah, they say, oh, give you some steroids and stuff. Yeah, that's only temporary. That's just to ease it up for a couple of weeks to do a steroid taper. But the real thing, I was talking to him for half an hour about this, is that you're going to have to change your diet. You're going to have to change your life, everything that you've done, and start talking to him about the algorithm of six and all these things because it's, and of course, before that, he ate junk food, he ate whatever, and a lot of stress in his life, and yeah, of course,
But
inflammation.
that's the difference too, with which is why I even brought you into my practice, was you discussing, hey, we've got to shift some lifestyle habits. We've got to go to the root and cause and say, hey, look, this is not just a medication thing. This is a lifestyle thing that you've got to shift because it's literally killing you. And so even how you were talking about the autoimmune diseases, that kind of because at the end of this, I want to end up talking about practical steps to enhance T4 to T3 conversion. But before we even get there, I want to talk about the autoimmune component, because what I have noticed, and I deal with autoimmune diseases every single week. I just dealt with two more this morning on Hashimoto's, and every autoimmune disease on the earth, no matter which autoimmune disease it is, every single one of them has a leaky gut component or some form of a gut component causing systemic inflammation, but rooted from the gut microbiome and stress and inflammation as well. And the one thing that I always see with every single autoimmune case is, in some way, shape, or form, regardless of where it is on the spectrum, some way, shape, or form, the thyroid is taking a hit.
Yeah,
And Dr. Pat Luce talks about in his book, Seven Systems Plan, that when there is a leaky gut or gut issue, the immune system actually mistakes gluten for the thyroid and the thyroid for gluten. So whenever it starts to attack gluten, it mistakenly attacks the thyroid by accident because it can't tell the difference between the two. And the one thing that I think is very interesting is, okay, gluten is found in three things: wheat, barley, rye. Wheat and barley are two of the promised fruits that God said he was giving in the promised land. They're actually very high quality foods, but why all of the sudden in the United States specifically, these last 10 or 15 years, is gluten, wheat, barley, and rye causing such an issue with people? And then, which is also one of the main reasons for a lack of T4 to T3 conversion. I have my opinions that I want to give, but why do you think all of a sudden the last 10 to 15 years gluten is becoming such a problem, whereas for thousands of years it has been one of the most prominent foods in the healthiest diets in the planet, especially the Mediterranean diet?
yeah. A lot of things have changed in terms of manufacturing processes or in our food industry, I think is the
Right there. That's exactly what I say. In fact, so I'm doing a test and I'm doing it on myself. Is I have some of the top sourdough breads where it's literally only flour, water, salt. That's it. It's the cleanest ones that you can find here in California. And I've been testing these different ones. And I always tell people, if you're going to get sourdough, make sure there's three ingredients: flour, water, salt. If it's got all these other fortified crap, get it out. There should
Yeah.
be flour, water, salt. But even then, it's not just about the flour, water, salt. It's their wheat flour. It's how well is it manufactured? And so what I just did, I just ordered a wheat flour, and it is called soft wheat flour because you have soft and hard. Soft is actually lower in gluten naturally. And you,
Yeah.
you want to know where I got it from? I imported it straight from Italy
Ah,
because I have a friend out here that only imports her wheat from Italy because how pure the manufacturing process is. Not only that, it's called soft wheat flour, so it's naturally lower in gluten. So I am testing out wheat flours, softer wheat flours from Israel, Greece, and Italy because I want to see in my own blood works as well as others if our bodies treat it the same way. I don't think they will. I genuinely believe it has to do with what you just said, which
yeah.
is our wheat flour here is so processed and manufactured so
Yep.
poorly, and it's grown so poorly because there's no way that wheat, barley, and rye and gluten in and of itself is the issue. Because, like I said, civilizations have thrived off of it for thousands of years. I think it has to do with our manufacturing process.
Yeah, I wouldn't be surprised at all. It reminds me of a case I had where this lady had rheumatoid arthritis, and yeah, I was asked at one point, Master, is there any time where it's not bothering you? She says, yes. She's from West Africa. She says, when I go back to Africa. And I said, what's different there? First of all, I have a lot of family there, but more importantly, we have our own farm there.
Yeah.
We grow our own food there. Interesting, interesting. So you own farm, growing your own food, and so what happens? I don't have any symptoms. Interesting. And again, given that the way our manufacturing processes are these days, and even with organic, I don't know you know, how truly natural and pure it is. It's better than non-organic,
It's better than non-organic, but it's picking
but
the
it's
lesser of two evils. That's all it is
yeah,
when I
it's sort
see
of
it.
like it's only half as bad. You know?
Exactly.
And so maybe for some people that's enough to get them by. But for others, I think you're gonna have to go further. The problem is, it's like I said, we're gonna do have your own farm, and it's finding the sources from where that are growing it the proper way, not putting pesticides and all sorts of chemicals. I mean, that all that stuff too. It adds up. And finding places that do that, I'd be interested to know how that experiment goes for you because
I just moved to California a month ago, right? The best thing, like I was just telling clients that I was working with the other day, I was talking to them, and I said, guys, all of the sudden, starting a week ago, I've been sleeping like a rock and full of energy. You want to know something interesting? I get 85% of my food from farmers markets.
mm,
And I talk to them directly, the owners of the land. I say, hey, how do you grow this? Do you spray anything on it? No, I don't spray anything. I don't do this. I don't do that. You want to know something incredible? Yesterday, me and a brother in the faith, we were meeting at 6 a.m. for some coffee, and he's got a bunch of land with a ton of food on it. And he said, whenever I was leaving, he goes, Nick, come over here and get a bag of a bunch of different fruit. I got Swiss chard, I got potatoes, I got onions, I got apples, I got blah, blah, blah. So as I'm filling up this big bag of stuff, he tells me, he goes, hey, so this is all, grown right here where you're seeing it. He goes, the only thing is these apples, I sprayed this on it. And he shows me, number one, what he sprayed. He tells me why he sprayed it. He said, I was having a bad problem with bugs just on the apples, so I had to spray it with this. But this is how you wash all this off or whatever. He told me that because this way, even what he sprayed isn't going to harm me. You're getting it directly from the source, and they're telling you how to eat this or do this, that, or the other. And I genuinely believe, Dr. Rajan, the last 4 weeks, I have become healthier than I've been in the last 10 years because I know where all of my food is coming from. The air here is so fresh. It's not just industrialized with all this nonsense in the air like the cities are and stuff. The air is fresh, which goes to your algorithm of six, environment, toxicity. My food is so clean. Even whenever I was living in Houston, I was only shopping at Sprouts, which is probably the highest quality food that you can get in stores. But guess what? It's still choosing the lesser of two evils.
Yeah.
And it's not as high quality as the farmers markets. I don't have all the pesticides running through my system. Inflammation and all these different things have gone down. So, no, I'm excited for this experiment because it does mess with T4 to T3 conversion. And I've even had a T4 to T3 conversion issue. And so, as we start to experiment with this every couple months and review the labs, review the markers and this, that, and the other, I'm curious to see how things start to shift, especially, like I said, with the gluten thing. The gluten, the wheat, barley, rye thing, that's going to be probably my most exciting experiment that I've done to date, because I think that if I can get to the bottom of this and prove it, it has the chance to go extremely viral, because gluten, the gut, and thyroid has never been more relevant and prevalent than it is today in 2024.
Yeah. Yeah.
Go ahead, Dr. Rajan.
Yeah. You know, of course, then the interesting thing is, so to make good food takes a lot more time than to make cheap processed food, right? And you think about it, if everyone knew the same thing, they would overload the supplier. And then part of the reason why we have all this low quality manufactured food that we have, because it is volumes and scale. And of course, but when you do volumes and scale, then you're going to sacrifice the quality. And they hope no one notices, but I think we've all been noticing as you see more patients with autoimmune disease, gut issues, and because, like I said, for some people, it's just not, yeah, they can't handle that. They can't handle that processed food. And again, organic, it helps. They've been able to scale that, but even then, if everyone did organic, would they even be able to handle that load? It's been steadily increasing. Now, before you'd see organic, remember 20 years ago, maybe one store, especially the like Whole Foods, right? They were the only ones. Now all the stores have an organic section, at least. But to get like the ultra pure, yeah, that is, you have to probably go search.
Here's the thing. There's 9,000 farmers markets across the United States. Now, granted, here, I've got them everywhere where I'm at. I can go to
Yeah,
3 or 4 a week if I want to, which I do. Like tomorrow, I'm going to the one I go to every week.
yeah,
But so, like in Houston, where me and you met, there's not a ton, but
yeah,
there's still some. You may have to drive 45 minutes to get to it. But to me, it is so worth it when it comes to the health aspects. Like I said, 80% of my food comes from farmers markets, my fruits, my vegetables, which is the basis of my diet. And
yeah.
then legumes, even I can get from there. All these, even my nut butters. I make my own nut butters. I just get my nuts from them. But you just food process in a Ninja food processor, it turns into nut butter. But the thing is, like you said, it takes time to cook the food and this, that, and the other. But Dr. Rajan, this is one thing I scream at the top of my lungs. We have to get back to making our food, getting to be like one with our food again, where we are making these meals. We're spending time appreciating it, because at the end of the day, your life literally depends on what you're putting into your body. And here's the thing is that not only are we more disconnected from our food than ever, we're more disconnected from our families than ever. Did you know that less than 30% of people have one meal or more for dinner with their families? So only 30% of the United States is having one dinner meal with their family. And even then, it's only one dinner meal.
Yeah.
We should be valuing spending time in the kitchen, preparing every meal, and slowing down our lives. Like we are literally, and the thing is, this is only in the United States that you really see this.
Yeah, this is particularly in the United States because this is the land of capitalism, and everyone's trying to make it in this country, make a living, and it's tough. This is one, and since living in the United States is like living in Hunger Games. Yeah.
100%.
And
100.
in fact, that's where some people, like if they're coming from another country to the United States, I've often had people say that in their home country they actually feel more relaxed and they're healthier. And I think part of it may be, like I said, that lady from West Africa, she has her own farm. But I think also just the lifestyle and the way things are going and the stress levels are just decreased in some for people. It is tough to live holistically, and particularly in this country where not only is this are the stress levels high, but the entire food industry and everyone around you is doing everything that wrong. And of
Right.
course, your medical system is oh, you got these diseases. here's some prescription drugs and medical procedures that we can recommend, which is, again, not really addressing the problem. It's treating symptoms as opposed to the disease. They may say it's treating disease, but the disease wasn't caused by a deficiency of Lipitor and metformin in your diet or the need for a cardiac cath or spine surgery in your lifestyle.
One of the things that I like something you said is that in the United States, like this stuff has become normal. Is one of the things that I have to tell my clients when I read blood work is on the right side, it'll say like interval ranges or whatever.
Yes.
Those are different for every place that you get the blood work done. They're not recommendations, they're averages of
Yeah.
wherever you're at. So the averages are poor, and you could have a testosterone of 200 and still be within that average, depending on the clinic of where you're going or whatever. And so I tell people all the time, I say, guys, these are averages. This is not optimality. This does not mean it's optimal. It means it's average. And one thing I always tell people is just because something is normal in the United States doesn't mean it's optimal. It is normal to live a stressed life. It is normal to eat fast food 3 times a week. It is normal not to make your own food. It does not mean it's optimal. If you want to live normal, then I'll tell you what else is normal. Diabetes, disease, and so is heart failure, given that heart disease is the #1 killer in the United States, over 400,000 deaths a year. Every 83 seconds, somebody's dying of coronary heart disease. That's normal. So if you want to go with normal, go ahead and do that. But
Oh, yeah. I'll give you more normal. Overweight and obesity, 70% of the country.
Yeah.
It's become normal, but it was never healthy. Never was healthy. It never will be healthy because physiology doesn't change for trends and fads.
Well, so then when people like me and you live the life we live, we're called extremists, when really what we're doing should be normal, right? This is not extreme. This is the way that you should be living your life. And just for the audience to know, you've mentioned your algorithm of 6. I have another podcast with Dr. Rajan where he actually goes through his algorithm of 6. So if you want to go through there, he talks about 6 bases of lifestyle, things that within your lifestyle that determine longevity, health, or the other side, sickness, disease, and this, that, and the other. And I do want to say I have something which I have not come out with publicly yet, but I have come out with these. I'm coming out with the 6 pillars of health and longevity. They're very similar to Dr. Vajan's, but my 6 pillars, they're nutrition, body movement. I didn't say exercise. I said body movement, environment, faith, because within the faith, I discuss stress management is involved in that. And then I have hydration. And then my 6th one is oxygenation. And so I'm going to start coming out with these things. They're very similar to Dr. Rajan's algorithm of 6, but I encourage you to go back and listen to that podcast because in that he goes in depth on this. We explain miraculous things in regards to stress and how much disease stress is causing. I see it in my practice on the daily. But with that, Dr. Rajan, I want to give the audience, which we're going to just repeat a lot of the stuff we've said today, but I want to discuss then some steps that people can go in to enhance their T4 to T3 conversion, right? So we've been talking about the issues with it are heavy metals, stress, cellular inflammation. The one thing that I always discuss is that the root of all these issues, at the end of the day, what we're really saying is the root of all your issues, if it's at the cellular level, it's mitochondrial. So when we talk about being mitochondrial and the energy sources of your entire body and of your cells, then really what we need to be discussing is enhancing the mitochondria. Would you agree?
Yeah. And it all goes back to me. It's like you said, that algorithm of 6, right? If you fix those things, then the body will fix itself. It will self-correct. It'll self-regulate. The thing that, particularly for autoimmune diseases on a conventional level, we always try to throw drugs that suppress the immune system. But suppressing the immune system, you need the immune system to keep you from getting infections. And of course, all of our immunosuppressants, their side effect is you can get other types of infections. Exactly. And what you need to do, not suppress it, you need it to regulate itself properly. And it's immunomodulation is more the term that I use rather than immunosuppression, even though you may have an autoimmune condition. It's immunomodulation to get it to where your body gets it under control again. And how do you do that? Again, You could try and throw specific drugs at it, or what made has just made more sense to me over the years. The more I see cases, the more I deal with integrated functional medicine, is fix that algorithm of six. All the issues that, whether it be, like I said, gut issues, gut healing, cleaning up your diet, and some supplements that will also help you along the way with gut healing, fixing the stress in your life, finding ways to address that. If you got any environmental toxicities, you got some mercury fillings that have been there for decades, okay, get rid of those things. Cleaning up all those things, and over time, body will heal itself.
Yeah. No, I think that's good because the thing is, like we said, the gut and thyroid peroxidase antibodies and reverse T3 are a major reason for the stealing of that proper conversion, which therefore is always gut related. So you've got to fix the gut microbiome. You've got to have a healthy gut. You've got to seal up leaky gut, which means that you've got to clean up your diet. You've got to manage stress. Stress is one of the top 4 reasons for leaky gut in the United States of America. And like I said, you've got to have a proper detox because the heavy metals are literally thieving T4 to T3 conversion. And heavy metals are such a major issue in the United States of America today. But then also, like I always say too, is we are lacking discussing autophagy, cell clean out and cleaning up mitochondrial function. Because if you think about the major things that hinder autophagy, which like raise mTOR, is too much protein, too much animal protein in the diet. That will hinder autophagy, stress and inflammation, and obesity, which is with insulin resistance.
Yep.
Those 3 things encapsulate the problem of the United States of America, which all of them hinder autophagy. And autophagy is the whole thing that's going to actually clean out your cells to help you be able to start converting T4 to T3, be more receptive to insulin, be more receptive to any hormones. And it's also going to fix the testosterone deficiency or disorder in the United States of America as well. So it is this entire lifestyle basis. And that's why I always tell people you need to either come under a functional practice for about 2 years, get your life in order, retrain your mind on what is really normal and optimal in daily habits, or like in your concierge practice, teaching these different things. But I think people just don't know how to do it. They don't know where to start because bad lifestyles have become so normal. I think 98% of people have never even lived a proper lifestyle. They don't even know what it looks like anymore.
Yeah, it's very difficult. In my experience, for those who've had disease and then figured it out on their own, without doctors, without a functional practitioner, they did it on their own, 1 out of 10,000. That's about what I've seen. Because I've seen
I
tens of
agree.
thousands of patients. I can think of a handful that have done it on their own. And yeah, that's about 1 out of 10,000 can do it on their own. The rest need some help, need a coach. And your conventional medical doctor isn't going to be able to coach that because they don't know themselves. They
Yeah,
have the same diseases as their patients a lot of the times. They
right.
themselves may be obese and on metformin and or Ozempic and high blood pressure meds and cholesterol and all meds and all these other things. And because again, we didn't really learn in medical school a lot about health and how to keep that health. We learned some basic stuff, but not really the depth that you need to fully teach that. And again, it was always like, oh, preventive. Once you have a disease, okay, here's your prescription drugs, here's your specialists and the procedures and all this stuff. That's what we learned primarily. That's 9% of the focus is this drug for this disease, these procedures for this condition. And again, if you're having an acute medical emergency, our system is very good about that. If you're having a chronic medical disease, our system is not very good about that at all because, again, that wasn't the cause. It wasn't the lack of a prescription drug that was causing your chronic disease or the need for a procedure. It's
Yeah.
that algorithm of six or your pillars of six. Yeah, it's the six. You have to fix that. That's not just the prevention, that's the treatment. And without that, then you will just continue to have disease. The only things that the prescription drugs, if they don't give you side effects, which some of them will, especially if you take enough of them, even if they don't give you side effects, at best, they will ease up the symptoms of your disease until you get another one because it'll come out in disorders in the algorithm of six will come out in any number of diseases,
That's right.
whether it be diabetes, high blood pressure, migraines, autoimmune, kidney disease, fatty liver disease, anything and everything. And when you fix that algorithm, the body will fix itself.
That's right. That's right. But like we said too, I think that they don't know how to fix that algorithm, and that's why you need to come under a coach and a program that can teach you for about a year or two. Because people want,
Yep.
you didn't get sick in 6 months or 6 weeks. You're not going to completely reverse everything in 6 weeks. So
No.
you're going to need some time to really do this, and you're going to have to totally change to where at first you're going to have to manually do it, but eventually this stuff comes by habit.
Yes, it's little things. Look, it's optimizing the algorithm of six. It's not easy. It's like building a great wall. But someone once told me this. This is that I think this is a quote attributed to Will Smith, right? But you don't go and just say, "I'm just going to build a wall." It's just like that. No, especially if it's a big wall, it's too much. So what are you going to do? I'm going to lay a brick.
That's right.
I'm going to lay another brick. Then I'm going to lay another brick on top of these bricks.
Yep.
You just keep on doing that, and eventually you build the wall. Great
Well,
wall.
and people always ask me, Nick, I wish I could be like you. I don't, because people know I talk about this all the time. I genuinely, and I'm not just saying this to be like the functional nutritionist and blah, blah, blah. I genuinely do not crave pizza. I do not crave candy. I do not crave processed food in McDonald's. I don't. I used to.
Yeah.
But the last 18 months, I have dedicated my life even harder than I ever have in the past 15 years to mitochondrial clean out and flushing my system and fueling my body. You crave what you eat and doing all of that, that now I have absolutely no craving or desire for any of that stuff. And that is possible for all of us. But we, like we said, I tell people all the time, if you're a doctor or a nutritionist in the United States and you've only lived and studied and practiced in the United States, you do not know medicine or nutrition.
Yeah.
Because all we know is the stuff here. Even if you're the best nutritionist out there, you do not know nutrition because all you know is the stuff here. You go to these other countries, the people that are not nutritionists at all know more about nutrition and lifestyle habits and reversing disease than any of us because they're living that stuff out. They only know that type of lifestyle.
Yeah. Yep. It's something that takes years. I've been going on this journey since I started learning it in 2014, and I've come a long ways from when I started. When I started, I used to weigh close to 180 pounds, and now I weigh more like 150 pounds. I had at one point when I was 180, I was starting to have insulin resistance, not get diabetes or pre-diabetes, but insulin resistance is the first step. And I got down to 150, that went away. I even recently had this thing, full body MRI and carotid scans and stuff like that. I had it done just to see. I'm like curious, and they were offering it to me, and clean, completely clean. I'm like, wow, I guess that's the power of healthy living. You
Yeah.
don't find anything wrong. And so it was great to know. It was a great confirmation that okay, all this work that I've been putting in is is showing results that can be actually seen on exams, which is basically lack of disease, lack
Right.
of issues. So
So let's close out with, I guess, so that people, so number one, for the audience, if you are on levothyroxine or any thyroid medication, this is for you. But honestly, this is probably for you anyway. You need to get your full blood panels done and you need to get a full panel, not just TSH, T3, and T4. You need to get thyroid peroxidase. You need to get reverse T3. Get it. You might as well get thyroglobulin as well. But you need to get all these things done. And some of the symptoms that you may or may not have if you have some form of a thyroid issue, just for the audience to go, huh, that might be me, is low energy, poor sleep, high A1C. In fact, 50% of diabetics and pre-diabetics have a hypothyroid because it governs metabolism. T3 does. I see it all the time. Fatty liver, weight gain, inability to lose weight, brain fog. That's a major one that I see is brain fog, lack of ability to concentrate, low basal body temperatures. You should be between like 97.8 and 98.2. I see people will be in the 96s all the time. They'll be cold all the
yeah,
time. What other symptoms do you think?
cold intolerance. You feel cold all the time. And
Right. Constipation is a big one. A lot of people that do not have bowel movements have teeth. They either have one of two things, methane SIBO or a thyroid issue. I see it all the time. Oh, the other thing is the outer third of their eyebrow will actually be missing hair. They'll have hair loss. And then also, you want to know what's interesting? 50% of all gut cases have a hypothyroid because thyroid, if you have a hypothyroid, it causes food to sit and ferment in the gut microbiome, causing bloating, SIBO, dysbiosis, all of these different things. So if this is you and you're listening,
yeah,
then there's a good chance that you probably have a hypothyroid and you need to address it. You need to address but you don't need to address it and just, oh, I have a hypothyroid, take this. You need to address it the way me and Dr. Rajan are talking about. And why do you have that issue? Why do you have the conversion issue? We need to get to the root cause so that, God willing, we can reverse this situation.
yes, the just putting yourself on thyroid, okay, that's, and again, depends on the type of thyroid. If you're going to a conventional doctor, they probably just want to put you on levothyroxine, and that's not really effective. So you want like an ARMOR or an NP thyroid that has T4, T3 combination for it to work more effectively. But the other thing is that's just scratching the surface because again, hypothyroid, it's generally Hashimoto's. It's an autoimmune condition, and which means you have disorders in that algorithm of six. You're going to have to fix that. Otherwise, you're going to be stuck on your thyroid medication forever until you
Yeah.
get another disease that's also autoimmune related potentially. That's actually the most common start of autoimmune conditions is the thyroid. That's I've seen very commonly. Like we're of all the people with all the autoimmune, yeah,
Not
thyroid is.
only not only that, which you're absolutely right, and not only that, 80% of all fibromyalgia cases were rooted because of a hypothyroid.
Yeah.
Not only that, the infertility cases I get,
Oh
every
yeah.
every infertility case I've ever had a tanked T3.
Yeah. Oh, another is important symptom of hypothyroidism, depression.
Yes, absolutely. Absolutely.
And given the issues of mental health in this country, yes, one is important to look at. And not only, not simply is it in the normal range, because again, normal range, if you're in the low normal range, that may not be good enough. Because again, those things are arbitrarily set to cover in the 95%, but they'll be like 90%, right? So there'll be like there'll be 5% on one end. It's like a bell curve. There'll be 5% on one end where it's not covering them, 5% on the other, and it's not covering them. They're technically in that normal range, but they're symptomatic.
And that's where me and you were having the conversation the other day that Dr. Brownstein talks about all the time too, is numbers are important because they make us dig deeper in a given area, but numbers do not tell the whole thing. If the numbers are really low, then it doesn't mean that they have something. You have to address the symptoms. Do they even have the symptoms?
Yeah.
Or the numbers are perfect, but they have the symptoms. A lot of people go to the doctor and the doctors ignore them because they're
Yeah.
just looking at the numbers. You've got to address the person, not the paper.
Yeah, it goes to the old saying that when this is a medical student, you have to treat the patient, not the numbers simply. It's all goes together. And so someone who's say they're normal, but they're on the low end of normal, and then but they have symptoms of hypothyroidism, you may actually want to consider putting them on some low dose armor thyroid and see how they do temporarily until you're fixing that algorithm of six. You may find that they actually feel a lot better at that time. So and that's the same thing if they're on the high end of normal, right? If they're high end and they're having symptoms, well, then you've got to make adjustments for that too.
Right.
Which on the high end, that's also an autoimmune thing, but on a different level.
I've seen a lot of people too with a low thyroid just because they ate low calories for too long. And once you boost their caloric intake and upregulate thyroid, the cortisol starts to drop from the stress of dieting and this, that, and the other. You actually upregulate thyroid. And so, one of the things that I want people to leave with is if you have a thyroid issue, number one, the question is always why, what's going on, dig the lifestyle, dig what's going on, the rest of the blood work, maybe a GI map and so forth. But if you're going to go on a thyroid medication, like Dr. Bajan is saying, an Armour thyroid, an NP thyroid, something that has a T4 and T3 that's glandular, and like it comes from like the glands of pigs or whatever it may be. It's glandular, it's more natural and so forth. But one of the things that I specialize with in my practice, and this is one of the things why I love working with Dr. Rajan, is you come to me, you might need to get put on this, that, or the other, but we address the root cause, and then God willing, within 6 months, 12 months, 18 months, we can start to lower the dose by 15 milligrams every couple months, and then hopefully be able to get you off of that because we fixed the root cause. We fixed, like Dr. Rajan says, his algorithm of six or my six pillars, those different types of things. But this is the approach that you have to do, but you have to be in this for the long haul. When it comes to thyroid and tapering off thyroid medication, you have to do that in 10 to 15 milligram doses, each change being a couple months into where if you're taking 90 milligrams of NP thyroid, that could take you 6 to 12 months successfully to taper off of. But this is not a short-term thing. This is really a lifestyle change going forward, right?
Yep, this is you have to whatever you do, you have to make it permanent. But if you do that, if you're willing to do what it takes, so I've seen some amazing things happen, and it's not just thyroid or autoimmune. Just I've even seen a guy with Alzheimer's that he changed his life 10 years into his Alzheimer's. Doesn't even look like he has Alzheimer's at all. In fact, he reversed most of his symptoms. As to where he was like, he looked sharp. He said, "Is there anything else I could do?" I'm like, "No, I think you pretty much did it all." And so,
Alzheimer's, which I'm sure you've just seen this so many times. Alzheimer's, number one, it's radically insane in the United States, but that is 150% a lifestyle induced disease. 100%.
yeah, there isn't any. We don't have any medications conventionally that do that. But to the extent that you change. Again, I saw it with this guy. I never thought it was possible because again, we're taught it's irreversible neurocognitive decline. This guy, he even wrote a book about it. I read his book before seeing him, and it was just like, man, he did all the things that I talk about in the algorithm six. He did it himself. He was that 1 in 10,000. He was one of
That's
those
right.
people that
Yeah.
did it himself. He made health his business. He was a business guy. He made health his business. He wasn't in the healthcare business, but he made his health his business
I'm with.
priority. And he didn't look like he had Alzheimer's at all. He said, "I did this. Is there anything else I could do, Doc?" I'm like, "No, I think you got it.
Right.
Just keep it up. That's all I can tell you. Keep it up, and congratulations." But it was amazing. It was amazing. So yes, something that's seemingly as intractable and incurable as that can be fixed with a functional holistic lifestyle. But to be able to learn that, if you don't know, if you're not that 1 in 10,000 that can figure it out yourself, again, that's very rare, then find a functional practitioner and in wherever you may be, find one and they can help you out because a conventional medical doctor, even conventional nutritionists, they may not know either
Yeah.
because what conventional nutrition is also taught wrong. And the stuff that you learn in functional nutrition, yeah, it blows your mind initially. But then the more you get into it, you realize this is what made sense the whole time. Like,
Yeah.
how come we never learned this? How come we were never taught this? And when we institute it in our own lives, we see the results. And that's why we believe in it so much and
Right.
to
That's
the point where we teach it to others because it's worked for us.
that's right. No, that's good. I think that this has been good for a lot of people. I think it's eye-opening. And as y'all can see, why, how Dr. Vajani is a wealth of knowledge, but more than a wealth of knowledge, he's a wealth of approach. You want to approach things properly. You want to approach it systematically. You want to approach it functionally. And he has a great balance of, yes, is he in the conventional world? Yeah, he's an ER doctor, but he has his own practice where he addresses things the ways he firmly believes in, which is integrative in nature, and it's functional, it's holistic, it's root cause approach, and this, that, and the other. You guys, if you're listening and this really resonated with you, or you know somebody it resonated with, and I know you know somebody it resonated with because 1 in 4 people in the United States are having a hypothyroid or issue of that nature. And so if this is you, feel free to reach out at lifestyleofeden@gmail.com. And please get connected with me. Please get connected with Dr. Rajan. And we would love to be able to help you. We'd love to be able to serve you and get to the root of your issues. And so, Dr. Rajan, thank you so much for joining and just sharing your knowledge. I know that you're a busy man. You work 80 hours a week in the ER and everything else. And so I thank you for taking the time out to really dig deep into this hot topic.
You're welcome. Thank you for having me.
Absolutely. So, guys, until next time, thank you for joining this podcast and stay tuned for the next episode.